Thank you so much, Cassandra, and a big good morning to everyone. Thank you all for joining us at this year's Mental Health Festival 2025. I'm super honored and excited to host and open this session today, to have all of our different clients, partners, stakeholders, and friends in this room today. This year's festival is our 5th edition, and with every year that we've done it since, it is our biggest one yet. So I'm really excited to kick off this session today with a couple of key points. Firstly, recapping what we've been on, this journey we've been over the last 12 months, what we're very busy working on for going forward, and also you hear from some of our leaders today, shortly after me, they will speak about our foundations we've built from operations, our network, our clinical expertise, and a lot more as well. So for the next 5 minutes, what I want to kick off firstly is to kick off with a brief welcome. And for many of you, you likely would be a little bit familiar with who we are. But for those that are tuning in, dialing in, or joining us for the first time, a very, very brief introduction of who Intellect is. So first and foremost, Intellect, we are proudly a Singapore-founded mental health care technology company. We were founded with a simple but ambitious mission to rebuild how mental health care access is done. When we started on this journey 6 years back, the thought and idea was very clear. A lot of people struggle with different forms of mental health struggles, issues, be it proactive, be it clinical, or more acute in need. But we found this simple and clear problem statement. A lot of folks don't know where to start. And that was what began our journey. And 6 years in, I'm really happy to share that we've made very strong headway in our own journey here. Today, Intellect has grown to serve and scale to over 4 million lives worldwide. We have the pleasure of serving many great global companies that you see on this screen here, and many, many more, many of you who are in the room here. And we have grown our platform from a preventative digital mental well-being platform today to a full suite of integrated mental health care services that ranges from prevention, subclinical, clinical, and even more acute downstream care as well. So with that brief background, let's dive into the festival. So a brief recap of what we spoke about last year. We've been on many different things, but the 3 big things we were on last year was firstly, expanding and pushing on our global footprint. Singapore, being founded in, Intellect, being founded in Singapore, has been always pretty globally minded from day one. We've always had a need to think about not just the clients and folks we serve in Singapore, but the many multinational firms, organizations that have a global footprint, and that's been a core part of what we've done. So that's a big part of what we spoke about last year. We also spoke about expanding Intellect's pillars of care from not only virtual and online to offline care, in-person care, and more holistic pillars of support. We also spoke about last year on establishing, and this is linked to our global footprint, more partnerships, different payers, different strategic partners across the world. And last but not least, this leads into what we'll speak about this year on our foundations and pillars for 2025. All right, so on to this year's theme. If you have not seen it around or seen it in the brochures and the mailers that have been going out to you guys, this year's theme for Mental Festival 2025 is Building What Matters. And what does that mean for us at this festival? It's quite simple and clear. Beyond just building a product or a platform, we believe that building for mental health requires a whole movement, partners, stakeholders, communities, all coming together and building together. Building what matters, basically. So what we'll share today, it's a lot of how we believe in building mental health care and thinking in the long term. How can we marry people? How can we marry clinicians, experts, and also technology in this whole work that we do here? And in the next few days, which I'm really excited to share, Mental Festival has always been a multi-day track. What's really exciting this year is that in our this edition of 2025 Mental Festival, we're going beyond an APAC track to even have tracks for US and Europe in day 2 segments as well. So you hear from a whole range of speakers all across the world in different time zones for people dialing in everywhere. And what we hear from this session today, it's a whole range of expertise. You hear from leaders speaking about well-being in the workplace. You hear from experts talking about self-care. We even have activities in the stations outside that allow you to build flowers, bouquets, and more, that you'll see a lot more intersections to come as well. In the split tracks that we have as well, you'll also hear about things like AI and mental health care. And we, again, as I shared, will have different expertise from different parts of the world, sharing about different cultures, ingraining mental health care in different generations as well. So there's a lot going on, and I'm really excited for you guys to hear that. All right, the last piece before I pass on to my colleagues later on to share more is this year's theme and what we're focusing on a lot. So 3 key pillars to begin with. First and foremost is doubling down on this global ecosystem of care. We believe fundamentally that there should be parity of care for everyone, no matter where you are in, what your country is, what your background is, and what your needs are. So we've been expanding this dramatically to increase our footprint, and you hear from our SVP of Ops, Valerie, shortly after on what we've been doing here. The second key pillar is on building the best-in-class experience. This has been the cornerstone of what we've been doing from day one. What sets Intellect apart from other traditional solutions has always been the user experience, from the technology to the care and the clinical governance. You hear a lot about this later as well. And the third one on this slide here that we cannot forget and miss, it's the clinical excellence that we anchor ourselves within. Since the very first day and day one, we've always been wanting to build the most clinically backed, evidence-based company and solution, and I'm very happy to share we've made very strong headway in this direction. And last but not least, first and foremost, Intellect is a tech company, so we cannot forget a lot of what's going on in the world in tech and AI. We'll speak a bit more about how we are ingraining and embedding AI into mental health care delivery, but importantly, how we're doing this with very strong clinical guardrails and how we're enhancing and marrying human and AI-led care for better outcomes, better access for everyone out there. So with that, that's my brief opening. You'll be hearing from some of our colleagues and leaders at Intellect today, and very first up, I'd like to welcome Valerie Chu, our SVP of Operations at Intellect. Valerie, please.
Good morning. Thanks, everyone. So I'm Valerie, the SVP of Operations. Delivering mental health care in 2025 is no longer just about access. For me, the work is cut out. We are looking at trust in the care that's delivered as well. People want trust in the care in terms of the languages that's being delivered in terms of the culture and the context as well. Let's look at the gap that we see in the ecosystem here today. WHO shares that 1 in 8 people live with a mental health condition. For many of us here, this could present in the form of anxiety or depression. And this has cost the global economy $1 trillion annually in lost productivity. A common term some of us may be aware of, and something that we're tackling for at many of your workplaces as well. The demand for mental health care has risen exponentially since the pandemic. But yet, we see that access to care remains largely uneven globally. Why is that? We see that mental health care systems and even traditional EAPs struggle to keep up with the demand. In low-income markets, more than 75% of people that need care never receive care at all. And in higher-income markets, we see wait times exceeding 8 to 12 weeks. That's a really long time to see somebody. In certain workforces where you're in the front lines or whether it's more remote, we see that the wait times can get way longer as well. So to find out more, we speak to many people, some of which are in this room here today. We speak to organizations. They say that they have an existing program, but you guys struggle with uptake. People do not trust the care that they see. And when we speak to some of the people, the users themselves, why are you not using the platform? We hear that they don't want to speak to someone that sits halfway across the world. They want to speak to someone that they can actually resonate with. So in Theo's segment earlier, we shared that this time last year, Intellect delivered care in 60 markets and 30 languages. Today, I'm pleased to share that we have grown from strength to strength, and Intellect now serves care in over 100 markets and 120 languages as well. All this to say that we don't just parachute someone in from a different time zone. We have intentionally built a network of professionals that are in the market as well. So to put this simply, whether you're an engineer in Tokyo or whether you're a doctor in Manila, you would be able to say that you have received care that's from someone that lives and potentially works in the same community as you as well. And that's what matters. Beyond just the service that's delivered, for the HR leaders here, the way that your programs are delivered matters as well. In Japan, we always lead with stress management. This helps us to reduce the stigma and to also encourage acceptance. In Australia, we actually abide by psychosocial risk norms that my colleague will explain more in further detail as well. So all this tied in together actually breeds trust. I say that word a lot, but with trust, we see better engagement amongst the users and organization-wide as well, and we see better outcomes. Outcomes that can be seen in a sense of session completion rates actually do double. People that trust the care that they receive come back for sessions 2, 3, and 4. I started off with saying that access is not the end-all and be-all. And the other 2 factors that are really important for my team and operations is the quality and the speed to care as well. So our service globally adheres to our Intellect clinical governance framework. It's implemented and developed in-house by our clinical team, Dr. Oliver, who sits right here. And maybe just to put that into perspective, for any provider that walks in through the doors, from the onset, you have to go through rigorous rounds of screening, you have to go through onboarding training, upskilling programs, and continuous clinical supervisions as well. This is something that we rarely see in many of the industry players. So with that, if you are speaking to a counsel in Jakarta, or even a clinical psychologist in Sao Paulo, you would be able to feel that the level of care in terms of quality is standardized even across borders as well. And that's really important. Some of you may ask, how soon can I see somebody? We hear about long wait times. So the industry standard across the traditional EAPs, we are looking at least 5 days to see somebody. If you're in a high-risk situation, that is a really long time as well. At Intellect, we consistently outperform the market standard. In key markets, our time to appointment is actually within 1 to 1.5 days. So practically your entire workforce, and yourself included, can see someone almost immediately as well. So to sum it all up, I've mentioned quite a bit of stuff. We have talked about localized care. We've talked about quality that's best in class. And we've also talked about speed to care that consistently outperforms the industry averages. With all that, that really matters. It builds the trust that I mentioned. And even for HR leaders, what you can see is actually measurable reductions in absenteeism and claims as well. So to help you understand this further on the ground, let us all now hear from Jerry, our market lead all the way from Australia, who will be able to share about how it's delivered on the ground as well. Thank you.
I'm Jerry Adele, the market lead for ANZ, and I'm really excited to be covering this section with you. Everyone in this room has a role to play in getting care to those in need, right? But historically, the industry hasn't been set up to enable you in this. You're being left to carry this burden on your shoulders alone. So the current environment, employees waiting weeks for appointments, lack of innovation for today's problems, employees scratching their head over ROI, and employees left alone to promote the program. This is exactly why Intellect designed on the ground support built around you. So now we have teams, clinicians, systems across the globe in the markets where your employees live and work. They understand the local context. They understand the local nuances, right? And we now have regional experts who align well-being goals with business goals. They understand, for example, that in Down Under Australia, we've got the psychosocial risk legislation. They understand that in the US, there's certain regulations that we need to help employees meet. And now implementation teams who stay beyond launch. Gone are the days where you say hello to your EAP supplier at launch and at renewal. We're here for the life of the contract, tracking key metrics over time, helping you raise the standards of your EAP program. And they're enabled, right, with plug and play comms and campaigns. You won't be asking us for certain collaterals to promote your program. We will be there in advance, equipping you with what you need. So impact that leaders and employees can trust. So doing all of those things, what has it resulted, or what have the outcomes been? So I'll give you a real example. So in Australia, we had some of our clients coming to us and saying, you've done a great job with our EAP, but we need to meet psychosocial risk compliance, right? It's complicated. Each state has varying regulations. How can Intellect assist with this? So Intellect is uniquely positioned, right? We have our in-house clinical research team. We're set up for innovation. And so we looked around Australia, we looked at the current services and assessments that organizations were using. We saw the majority using the Copenhagen psychosocial risk assessment tool, but we saw that was designed for EU framework. That didn't use local language, and it missed key markets like mining and construction. So we went out and we delivered our own, right? Designed our own and delivered our own so we could meet the local market's needs at the highest standard possible. We now have the ability to de-identify workers' compensation claims data and medical data and show how intellect has impacted those areas, right? How's that now for ROI? No longer will you be scratching your head. We then have had results in retention, right? Reducing resignations due to more poor mental health by 16%. So in short, it's now shared success. You don't carry the load alone. Intellect's there to support you along the way. And boots on the ground only works if the services we are delivering are scalable, they're trusted, they're effective, they're clinically validated, and they're safe, right? And that's where Dr. Oliver's team comes in. And I'm really excited for him to take on the next section where he's going to discuss this area and also on how technology is enabling care for Intellect clients. Over to you, Dr. Oliver.
Thank you, Jerry. Good morning, everyone. I'm super excited to be here, and I'll be spending the next 10 minutes or so to talk to you about our amazing clinical quality and how I think we do a fantastic job to ensure that every employee gets the right level of care whenever they need it. Okay, so first up, we look at clinical quality through various lenses, but there are 4 important pillars. One is clinical governance. We have an in-house clinical operations team, which has tight oversight of the risk of every employee, from triaging, care navigation, and signposting to the right level of care. We have very strong escalation and risk frameworks in place, and we also have an in-house clinical excellence and training team. Valerie has just mentioned that we supervise our providers. We also train and upskill our providers. We tightly track their quality metrics, and we ensure that around the world, wherever your employees are, they get the same level of care as you just heard, and that's ensured because we own the provider network, and we make sure that they all go through the same onboarding and training and so on. And lastly, thirdly, we have an in-house clinical research and innovation team, and you just heard Jerry allude to that. So from day one, we have invested heavily in the scientific validation of all our product and services. We're very data-driven, and we always pay attention to the efficacy of what we do. And I'm excited to share a few studies with you in a moment. And the 4th pillar is about consistency. You also heard Val share how we are now in over 100 countries, 120 languages. We pay particular attention to adapting those risk protocols, our treatment protocols, in a culturally nuanced way, okay? So that every employee speaks to someone in their own language from their own background. Okay, this is a busy slide. I'll take your attention to to my right side here. We have an active research pipeline, and I want to call out 2 studies in particular. First up, our very first randomized control trial on mental health AI, which we've just completed in partnership with the National University of Singapore. Now, many of these chatbot studies you may have heard about, they look at symptom reduction, okay? We have improved on existing AI research in 2 particular ways. One, besides symptom reduction, we're also looking at promoting well-being. So we found that respondents in this trial showed just after 4 weeks improved resilience, performance, and well-being in general compared to the control group. And secondly, we understand that clinical safeguards are extremely important. You probably all saw the news that tragically we lost several users who committed suicide because they had an over-agreeable AI with them. And so what we do at Intellect, we always have humans in the loop. So what we've done here is we have a 24/7 risk system in place. So whenever a user mentions anything remotely related to risk, It gets flagged up internally, and our 24/7 crisis intervention unit gets immediately alerted, and they reach out immediately to the user. That's a very, very important distinction and a very, very important quality feature. Okay? And we'll be publishing the study very, very soon. Next up, you just heard Jerry talk about psychosocial risk compliance. And I want to share with you how Intellect responds to this demand or this rising need. Australia is heavily regulated in terms of psychosocial risk compliance. Now, and we see legislation around the world tightening when it comes to psychosocial hazards. Things like remote work, complexity of work, workload, work-life balance, but also bullying and harassment and many, many other hazards. Okay? As well as the resources your company may already have in place and the adequacy of those. All has an impact on the employee's well-being, burnout, for example, or depression and anxiety. Now, if your company operates globally across markets, how do you ensure that you meet compliance standards globally when there's different tools in every market? That was a real quandary, and the way the Intellect clinical team has responded to this is by doing what I think we do best, which is we developed our own tool. And so I'm very proud to stand here in front of you to share that we've just completed, really hot off the press, our own globally compliant Intellect psychosocial risk tool, which is culturally nuanced and it's localized. So what that means is you have one tool, you can adapt with a few extra modules you can add or remove, depending on compliance in the various markets. The tool is one thing. We also give you excellent consultancy around it and in-depth reporting, which is 100 pages plus, which uses an intuitive traffic light system that flags all these hazards to you and helps you to monitor, to rectify, and then assess later on whether you're on track to meet those standards. Okay, now moving forward, looking ahead, what's in stock? Okay, here's a sneak preview, and we have very, very exciting research in the pipeline. One is with Duke NUS. We have a partnership, and we are planning the first worksite randomized control trial on financial ROI. Super, super exciting stuff. We have now just launched actually our own return on investment framework. And if you're a client with us, or you plan to be a client, I'm inviting you all here, come and talk to me or come and talk to us on how we can show to you that actual mental health improvements translates to actual measurable claims reduction, presenteeism improvements, absenteeism improvements, and so on. And we do that in a data privacy preserving way. Super, super good stuff. And secondly, with our global expansion, we have now partnered with the University of Pennsylvania, which is one of the top Ivy League schools in the US, and we are co-developing AI innovations in mental health. And we particularly look at how can we speed up care more, how can we reduce cost, how can we partner AI agents with therapists and so on. Really, really exciting stuff as well. And you can expect a few more announcements over the coming year. Okay, now tying it all together, how do we ensure that people get the right care when they actually need it? And I'll share now a little bit how we think about AI at Intellect. First up, we never aim to replace humans with AI. We use AI to augment the care, okay? That's very, very important. As I just shared, we always have humans in the loop, very critical. AI helps us to provide smarter triaging, and it gives instantaneous access, no matter where you are, 24/7. We also enable our providers to spend less time on admin. As my colleague Potik shares, clinicians, they don't become clinicians to do admin work. And you can imagine if you have a 1-hour therapy sessions, you spend usually 20 minutes on doing notes. With our AI scribe, that's reduced to maybe 3 or 4 minutes. Importantly, providers can also edit, so it's owned by a human again. And lastly, you get a wealth of insights via our AI-powered dashboard on the organizational well-being in your company. We have prepared a short 1-minute clip. I'll show you this now, and then I'll pass back to Theodoric afterwards. Let's have a look. So that's Intellect Guardian that gives instantaneous access to users. And it also improves the matching algorithm, so you get the best possible provider that matches your needs. That's Intellect Cruise, so that's meant to enable providers for better diagnostics, better treatment planning. So essentially improving the efficacy of care. And that's Intellect Vault, that gives you a wealth of insights into the organizational well-being. You can query the data as well if you don't know where to start. And I'm inviting you all as well, come to our booth. We have our CTO Anurag and our VP of Product Protik there to show you what we've built in our AI lab. Please come have a look later. It's right over there in the corner. So in summary, we have built a clinically proven ecosystem with financially measurable outcomes and scalable AI. With that said, I'll pass back to Theodoric, who will introduce our guest of honor. Over to you, Theo.
Thanks, Oliver. So I'll just wrap up very briefly the opening segment for this whole festival. Firstly, thank you all to all of my colleagues for sharing very, very important things of what we've been working on, from the network to the clinical efforts and the localized care. So I think it's a very strong testament to all of that what we're building today. It's that it doesn't start or stop with one particular pillar. It needs different pillars and it needs different stakeholders, all of you guys in the room, to help us make this happen. So before I hand over to Cassandra, our MC of today, and also our SVP of PNS, to kick off the festival formally, I also want to share that beyond the sessions today, we have a lot of exciting stuff we have got going on. For the first time, we're going to have a presentation segment for the Trailblazer Awards, which will honor and recognize some of the leading employers we work with for very commendable efforts in well-being in the workplace. And we also have breakout sessions at the end, curated breakout sessions for select invited groups to actually break out and have round tables around as well. So a lot more that will happen. But with that, thank you all for joining once again. I'll pass it over to Cassandra, our MC for today, to kick us off. Thanks.
Thanks, Theo.